I started working with Resolve Poverty in 2023, and at the time we commissioned Resolve Poverty to do a review of NHS Greater Manchester in relation to our role as an organisation in responding to and tackling poverty as a driver of ill health. And from that review they produced a report that had a number of recommendations, and we have been working with Resolve since then as both a strategic partner but also as a provider of services to respond to those recommendations that were made within that report.
We worked with Resolve Poverty to develop our mini advice referral tool in Trafford, which has been a great tool to be able to allow frontline staff to guide residents to the right financial support.
They developed something called the Money Advice Referral Tool, the MART, which has been really successful for us in terms of getting the message out about all the various services we offer through our partnerships.
They have worked with parents to access benefits that they never even knew that they were entitled to. It's made a huge difference to parents' lives, children's lives, and we've been really thrilled. The families have had increased income. It's meant that a lot of them have had better mental health because they haven't had the worry that they've been struggling with trying to feed their families. The children are able to concentrate better on their work in school because they are well fed, they're able to heat their homes, they're able to buy the necessary things that they have. The parents are happier, therefore the children are happier. Things that children shouldn't have to worry about, they're not having to worry about as much anymore.
In relation to impactful change, I feel we're really at the cusp of a big change thanks to the work that we've done with Resolve Poverty, and that relates to us considering the voluntary adoption of socioeconomic duty. We understand that if we move forward with this, we will be the first integrated care board to do this in the country, and once that has been approved and agreed, that gives us a really strong foundations to embed tackling poverty kind of throughout our system.
One of the things they did for us was the engagement with the public. So we felt we knew what people's lived experience was of poverty. But I think with Resolve Poverty supporting us with that engagement, they met with resident groups, they met with third-party organisations. And so effectively, I think for the first time, we got a real insight into some of the difficulties that people were dealing with out in the community in Bolton.
One of the key things I found when working with Resolve Poverty is that they're very, very expert at tailoring their advice per local authority. So sticking to the fundamental approach of tackling poverty, and whether that's implementing the socio-economic duty, whilst they're still sticking to that, they always provide that advice and guidance in a really tailored manner, which I think is really, really important and something that was extremely beneficial to us.
We have lots of brilliant organisations and partnerships in Bolton, but I think specifically the type of work that they've done over the years and the involvement they've had with the government, even probably in determining some of the policy going forward, I think there's a unique offer there from Resolve Poverty, and I think that's what attracted us to entering into a more formal arrangement with them So, you know, we've been delighted really with the way that partnership's worked. And the great thing is we've got them for another couple of years.
For myself, for NHS Greater Manchester, they also have that really important local insights and understanding of our Greater Manchester population. So I think for us it's a really good blend of kind of that national and regional understanding and support.